Hello, world. Welcome to Africa Let's Talk. My name is Collins Kofi Opon. You can always call me Mr. Beyond. Indeed, this is a special edition of our community broadcast. Tonight, we delve into a critical and timely topic that impacts many within our community. Like I said, this has always been a very critical and timely topic that affects many people, families, and individuals within our community, which is mental health, opioid use, and of course, the suicide prevention within Sub-Saharan African population. This broadcast aims to shed light on these pressing issues. And of course, we'll also try to explore some available resources and discuss ways to enhance support and awareness. Remember, this is actually a lead-up conversation to a big forum that is coming up tomorrow, which is organized by very, very engaged community organizations in our community. And of course, we'll be talking more about these community organizations. So please, if you have joined me, invite your friends and let's get a conversation on. In the meantime, I would like to welcome our panelist or our guest for the program. Ladies and gentlemen, I'd like to welcome Mr. Henry Momanyi. Mr. Henry Momanyi is here with us, and we are definitely very, very privileged to have him join that conversation. He is with the GANS Incorporated, and we'll be talking more about their organization. We also have Dr. Omoto Raphael. We'll be talking to him as well as part of this conversation, which has to do with the mental health, the opioid awareness, and of course, the suicide prevention within the Sub-Saharan African community. I also have the privilege of having with us Dr. Richard Onim. He's also here with us on this conversation, as well as Dr. Ola Tutoloplope. I think forgive me. And again, Madam Veronica is also here to join us in this conversation. So please, wherever you may be, welcome to the program. Like I said, this is a lead up to a big conversation that is coming up tomorrow, and we would like everybody to know about it as far as the topic of mental health, suicide prevention, and opioid use are concerned. Ladies and gentlemen, please, you are very welcome.
Thank you.
All right, sounds great. Of course, as we delve into the conversation, I would like to start with you, Dr. Omoto. Maybe as I definitely pose your question, if there's a brief introduction of yourself and work, you may start with that. But of course, the main question for you is, what is the current state of opioid use within the Sub-Saharan African communities, and how does it differ from other demographics in terms of prevalence and also their impact? I was wondering, wow, is this really a case in our community? Because I was thinking that our community probably was free from the use of opioid, but please, we'd like to hear your thoughts.
Okay, thank you very much. Again, my name is Dr. Raphael Omoto. I'm the director of Metro Behavioral Consultants, PLLC, based in Brooklyn Park, Minnesota. I'm a psych mental health nurse practitioner specializing in mental illness and substance abuse. Commonly, we call that dual diagnosis or concurring disorders. Good evening, everybody, and thank you for coming to this session. Now, the current state of opioid use within Sub-Saharan African communities and how it differs from other demographic in terms of prevalence and impact. I would say that the current state of opioid use, and opioid use in this case, I'm referring broadly to even other substance use, like the use of cocaine, meth, crack, THC, marijuana, cigarettes, alcohol, all that. So the state of opioid use within the Sub-Saharan African communities in Minnesota actually reflects broader trends in the United States. But for Sub-Saharan Africa, it has unique challenges. Now, currently, data specific to this community, the Sub-Saharan African community, is very, very limited. However, we can still get insights from what is reported, from various reports and the general trends in the state. Recently we've had enormous loss of lives, among our communities. Some of our young ones committing suicide. At least I know each one of you knows one of African immigrants who are currently homeless. And that's just because of mental illness and substance abuse. So, as I said, we do not have, data don't lie. But right now we don't have data to show that. But what we know is that the trend, the current trend of opioid use among Sub-Saharan African communities, it reflects the trend of, the current opioid use in the United States. And those from the last statistics for 2023, I mean, it says that at least 187 people lose their life daily from opioid overdose. Not to mention those who get, involved in accidents and some other long-term side effects. You don't mention that. So opioid use in Minnesota has been rising. That's based from the data we have currently. And the Sub-Saharan African communities are not exempt from this trend. For example, in 2022, the Minnesota Department of Human Services reported quite an increase in opioid-related deaths across all demographics.
Wow.
It didn't specify, that these are people from the African community. Mostly they lump us together with African American or minorities. Okay. Now, you realize that data shows that African American, now in this case I'm including even the Sub-Saharan African communities, there's 4 times chance of them dying from opioid overdose as compared to their white peers. Okay. Now, while there's no specific data for Sub-Saharan African immigrants, always it's not they don't categorize that data separately for for Sub-Saharan Africans. They don't categorize them separately, but they belong to that part of the statistics, which shows an increased vulnerability due to socioeconomic factors and other socioeconomic factors or social determinants of health. Social determinants of health, including the environment, the policies that are in place that will be protective to some of these.
Doc, we will definitely come back to delve more. More into the subject of this particular substance abuse. Like I said, for me, I didn't even think it was a big deal in our community. And the fact that also there's been a lot of education, and we also realized that it's not really stopping the usage of this, means there has to be more education. I was going to come to you to talk about resources and support systems that are available. But if Madam Veronica is ready, I'm not sure. Because we mentioned about younger people and younger folks who are mostly affected in this area. We want to know from you, Madam Veronica, how can we involve youth and younger generations in these discussions and initiatives to ensure sustainable impact on mental health and opioid awareness? Like I said, uh, it's affecting the youth in our community. And before I even come back to you, Dr. Omoto, to discuss the resources available, Madam Veronica, how can we ensure that these conversations are getting to the very people who really need to hear them or who have much impact?
Thank you, Collins. As I say, my name is Veronica Rotich, founder and executive director of Minnesota Africa Youth Initiative. Been working with the African youth. I want to say going to about 6-7 years now. And yes, we have a lot of youth that are impacted by this. And most of, we had a conversation with Dr. Tolo today earlier on, and I told her, I said, most of the youth, um, it's stemming from not belonging. I'll say, when they go to the African side, they're told they're African American. When they go to the African American side, they're told they're African. So first, they don't even belong. They don't know where they belong. And that just brings identity issues. Identity issues bring up a lot of mental health. The other thing is we African parents do not talk to our kids about drugs, drug abuse. And they go to school, and one of the parents from, that you talk was telling us that their child was trying mushrooms because somebody told them that they should try some mushrooms. In our homes, we know that we eat mushrooms as a food, but there's different types of mushrooms, which our kids are not educated in what they are. So they ate the mushroom and they didn't realize it was a psychedelic.
Wow.
So they had they ate it, they were fine, but then they got the effects of the drug, which sometimes makes you take a trip. So a lot of our kids is because they don't have the knowledge.
Mm.
Some of this is brought by their own personal friends. We had a situation in Bloomington where a child stole their parents' prescription book, who their parent is a doctor, and was selling the prescription, and
Wow.
telling them, oh, you can study longer, you can stay up. So a lot of our youth are taking these drugs not knowing that they're drugs. They're thinking that my mom wants me to have an A. If I take this pill, I'll be up all night. But they're not realizing they're taking the ecstasy. So they're taking the pill to stay up all night to study so that they can get an A. But then they get hooked. So all of a sudden they're continuing to take, they're going to college and they're continuing to take, because when I take this, but they're not aware that they're actually, using drugs now. It's
Wow.
just a simple thing like that. So a lot of our kids, it's because they just don't have the knowledge, and now they're just being, so if you don't teach them, the world teaches them. So that saying is literally playing in our lives now, is the world is teaching our kids things that we haven't sat and had conversations with. We have kids that are actually doing it so that they can keep up, to fit in, because they're not
Mm.
fitting in. So, hey, this group is smoking weed. Weed is legal in Minnesota now. I've had a lot of youth telling me that, oh, it's
Mhm.
legal now. And so, to fit in, these kids go and hang out and they're smoking weed. But if I don't smoke weed, they say, oh, you're gonna tattletale, or you're not part of us. So they're starting to take weed so they can fit in to be in that system, because we Kenyans are telling them they're Africans, or they're not Africans, they're African Americans. I tell them, oh, you're not African American. So to fit in, they're doing that. So a lot of our kids, that's also one of the reasons why you find that they're doing the drugs, is just to be able to fit in into the society that they've come to live in right now.
Indeed, this is quite a challenging situation and a very interesting one. And of course, the reality is that many homes, and especially there was a time that I had those conversations, including sexual abuse, and somebody said, "Wow, they are young, and so they don't need to hear these things." And another parent said, "No, they already know about these things." So it's good that we're actually talking about these issues that are very prevalent in our community, and it's about time we bring the conversations to the doorsteps of the youth and, of course, involve them. Dr. Oni, I would like to come to you at this point. I would like to know what role does our cultural beliefs and stigma actually play in mental health and substance use within the sub-Saharan communities? And, of course, how does it impact the willingness to seek mental health care?
Thank you very much. My name is Dr. Richard One from Progressive Individual Resources, and we've been around to provide services in the area of mental health to our immigrant population as well as people from background that are different from the mainstream organization here in Minnesota. And I'm here this afternoon to address this type of topic that talks about stigma. My over 30 years in this field has shown nothing but stigma and unacceptable of the services. And this is due to our culture. Many of the people here that are from Sub-Saharan Africa left Africa, but Africa did not leave them. So the idea of how they perceive mental illness in that country or in those countries where they come from still migrated with them here. And so that has been a problem in terms of how do people now accept the services that they abandoned in their home country. And to welcome that new idea is very difficult. We all know role is a major character of what we do. Role impacts, the role of culture impacts everything we do. It determines who is healed and who is sick and who is not sick. The role determines which doctor do you see? Do you see a male or female doctor? That is the role of culture. And when you look at that, it impacts the way we express the illness. The language we use is different here than the language we use back home. And so when we talk about this issue, the culture of the clinician is different from the patient. The culture of the society is different. The culture of the patient themselves different. So when you look at those three people and there are three cultural differences, you can see how that really impacts the services that we receive in Minnesota and across. And so we cannot excuse not paying attention to the culture. Actually, that's what we call cultural bound. The cultural bound of illness and syndrome of mental health is what determines what type of sickness that we're having and what type of services that we need to receive. The culture bound this is a specific mental health services or illness that is bound only for some group of population. And when you have that, it is difficult for mainstream clinician to understand that because that one talks about symptoms that are more of body ache when they're describing something that is behavioral. And now they're comparing that to some physical illness. And so when you see the languages in mental health, it makes it difficult. And as such, we clinicians in that field that are from other sub-Saharan Africa, we understand that. But we're afraid for the people that are mainstream, that our people go to. They prefer to go to that place that don't understand those culture-bound syndrome of their distresses and how they tackle that. A majority of the mainstream organization or clinician will not ask you, if you feel this way in your country, how do you deal with that? They just assume the same scientific Western way or Western lenses of illness that they will prescribe for people like us. And so that is why we believe that we need to practice culture and respect the culture. It's very
Indeed.
important.
Indeed, practicing culture and respecting the culture. Once again, you are watching wherever you may be a live broadcast of the community discussion, which is ahead of the upcoming mental health, opioid awareness, and of course, suicide prevention within the Sub-Saharan African community. This is actually taking place tomorrow, Friday, 5 p.m. to 8 p.m. We'll be talking more about this conversation. But of course, when you attend this event tomorrow, you are more than you are expected to actually hear from expert speakers, testimonials of community people who have been affected by any of these issues we are talking about, as well as how we can all come together to succeed. Of course, my guest panelists today are Dr. Ola. She is the founder and executive director of Restoration 4. We are also having here Mr. Henry Momanyi, the executive director of Gangs Incorporated. Dr. Richard Oni, who just spoke, who is the director of training and services at the Progressive Individual Resources, as well as Veronica Rotich. She is the founder and the Executive Director of the Minnesota Youth Alliance. We also have Dr. Omoto Raphael. He is the Director of Metro Behavioral Consultant. Please, if you have any questions whilst we delve into this conversation, please, you can leave them in the comment box, and I'll be more than excited to talk about these questions. Of course, I'd like to come to you, Dr. Ola. I would like to know, what are the specific risk factors and warning signs of suicide within the Sub-Saharan African community? Is it different from other communities, and how can our community members be educated to recognize and respond to these signs?
Thank you very much, Mr. Beyond, and thank you to the other panelists who spoke before me. You made my question easier to answer by talking about stigma and also by talking about a sense of belonging. And we know that within the Sub-Saharan African communities, there are several specific risk factors that contribute to the prevalence of suicide. And, just because we find it so difficult to talk about because of the stigma, it's so difficult to really put it in a way that we can disseminate to say, this is what it is. Sometimes, we hear things and then we become judgmental. And just because of that, people will not talk about how they are feeling, what they have gone through in case there is a case of suicide in that community. So just because the way we take the news, the way we process it, tends to be judgmental sometimes. And what we attribute this to is a risk factor for these children, and they will not talk about it, especially for our youth. And I want to say that some of the risk factors that we have read about and that we already talked about today, Veronica mentioned it, there is that factor of cultural displacement and identity issues. These kids and youths, they are neither here nor there. They don't belong to the culture of their country of origin, and also they don't belong here. There is a different culture at home, and they see a different culture in their school. So just because of that, they struggle with cultural displacement and identity issues. So the stress that they go through adapting to a new culture, we call it acculturative stress, while trying to retain the culture that they are bringing from their own country, can create significant internal conflict and stress. Also, I want to talk about trauma and pre-migration experiences. And I will not only talk about the pre-migration stress experiences, I will also talk about the migration experiences and also the post-migration experiences. Many refugees, some immigrants, they experience severe trauma due to war in their country, persecution, violence, loss of loved ones, losing their network. These traumatic experiences can lead to post-traumatic stress disorder, PTSD, and other mental health issues. These are risk factors. Also, isolation and loneliness, economic hardship. We talk about self-sufficiency. People come to the United States with a lot of expectations. When those expectations are not met, it becomes a problem. They will tell you, when I get to America, I will send money home, you build me 10 houses. And, they've lived 15 years, 20 years, they're not able to achieve that dream. It becomes a burden. And just because of that, they start thinking, why don't I end it all? Do I have any more hope left? That's a problem. Talking about all these things, we need to really see the contribution that legal and immigration status is causing among our immigrant and refugee community. When you are uncertain about your legal status, you don't get, you don't get benefits that you are supposed to get, or you are facing the threat of deportation. It becomes a problem. This can significantly cause anxiety, fear, and also hopelessness. And this contributes to a lot of mental health issues that we see around. And lastly, I want to talk about family separation. Many immigrants and refugees, are separated from their families, either temporarily or, permanently. That emotional toll, of this separation can lead to feelings of hopelessness and despair. So what are some of the warning signs? When you see behavioral changes, Dr. Oni can attest to this. There are times we go into the community and we talk about mental health literacy. This is what you need to look out for. And leaving that community about a month or 2 weeks after, or a month, 2 weeks, 3 weeks after, you just heard the news in that same community that a child or a youth actually died by suicide. That is to show you that we are not sensitive enough to behavioral changes in our youth. For example, if we notice that some kids are withdrawing from social interactions, loss of interest in previously enjoyed activities, or drastic changes in their routine, all this can be warning signs. If a child is telling you, I'm thinking, I'm not feeling good, I'm anxious. The question an African parent will ask is, what are you worried about? What is causing you anxiety? Are you the one paying the bills? These are some of the things. Substance abuse, increased use of substance, I want to say, as a coping mechanism, can be a sign of underlying mental health issues and suicidal ideation. Let me stop there. Yeah.
Indeed. I mean, thank you so much. These are very insightful conversation, of course, delving into the issue, bringing out the risk factors, and of course, some of the signs that we need to look out for. Sometimes we ignore them. Sometimes you may not be feeling your best self, and it could just be something that has triggered it. And these conversations are important so that we can get to know of what it is. Of course, the community have tuned in. Okay, Catch Tracy says, hey, Neno Senior Rotich. I'm sure she is giving a shout out, or he or she is giving a shout out to Madame Rotich. And of course, Huda Momanyi Hetler, she said tuned. Indeed, she's tuned in. And Lorraine Singer, please, if I got your name correct wrong, pardon me. But she says, Dr. Oni, thank you for sharing those thoughts. So true. I wonder how might clinical or mental health practitioners' own biases to our varying cultures affect the outcomes of persons seeking treatment or services, and how we create a safety net to ensure those biases don't become normalized. Indeed, I'm going to come to you, Dr. Oni, later to kind of touch on these questions. But for now, I'd like to bring in Mr. Harry Momanyi. We'd like to find out from you, how can community members actually get involved in advocacy efforts targeted at mental health or opioid awareness, and of course, suicide prevention? I think now more than ever before, this has become a community thing. I mean, we have to be open about it. We have to come together. But we want to know how can we actually do more than this by coming together as a community?
Yeah, thank you. Thank you so much, and good evening, my fellow panelists, Mr. Beyond, for this opportunity. Also, to talk about our event, which is coming tomorrow. To answer your question, or before I answer your question, my name is Henry Momanyi. I'm the Executive Director of Global Health Services, doing business as Gans Inc. We are located here in Brooklyn Park. And my agency specializes in early intervention and outreach services in the African immigrant community in matters social determinants of heredity, and that is HIV and AIDS, mental health, suicide prevention, opioid, and alcohol and substance use disorders. Okay. So, as a community, we have to collaborate. We have to form some partners with various agencies, various providers who deal with these, cases of, mental health, suicide, opioid, and suicide prevention. And what I mean by that is there are some resources which deals with such cases of mental health and substance abuse, opioid, and suicide prevention. So as a community leaders, we must know where we get these resources. And when we get these resources, we have to refer our people so that they can get, the right treatment. And by that, I mean, even starting with these panelists here, these are the kind of the resources we are talking about. The solution for All Inc., progressive individual resources, metro behavioral resources, youth affairs, or youth what? Youth, Veronica?
Youth initiative.
Yes, and Gans Inc. And also once you get to refer these people, for example, to the right people, especially we have, professionals in various fields. For example, we have doctors, we have psychiatrists, social workers, counselors, and other mental health professionals, drug and alcoholic specialists, certified biospecialists, therapists, psychotherapists, and other professional supports.
Okay.
This is very important because if we come together as a community, I think we can make some inroads. We can make a big difference. And again, as a community leaders, as parents, as providers, it is time to come together. We approach various, community leaders, especially church ministers, community organizations. And then we put some, we hold some seminars, town hall meetings, talk about the relevant in the house. We have to start talking about it.
Indeed.
There's no way that we can bury our heads in the sand and we think that there could be a difference. So as community leaders, we must come together and work together towards a common goal. And that's what we mean by resources in the community.
Okay. All right. Thank you. Thank you so very much, Mr. Momanyi. Indeed, talking about how we can come together as a community, of course, as we build advocacy towards these very important topics that are actually destroying lives, taking lives. But hey, there is hope, because when we talk about it and we find means to really prevent these occurrences, they go a long way to build the community that we are all looking for. Of course, Dr. Omoto, I would like to come in at this time. I know we talk about resources, but of course, specifically to your work and what you have experienced, what are some of the resources and support systems that are actually currently available for somebody who is struggling with mental health and opioid use in our communities, and how can these be improved? We want to know, if I'm watching and I'm struggling with mental health, I feel I need help. What is available for me?
Well, thank you very much. Just like I was saying before I talk about the resources, just to mention what, when I started, I said that the challenges Sub-Saharan Africans face are unique. And of course, just to mention what Dr. Talu said and Dr. Onion, the stigma and the risk factors, those becomes a lot of barriers to Sub-Saharan Africans, and these barriers exacerbate the impact of opioid use within these communities. Just because of all these barriers and challenges, even language, providers who are not very culturally competent, place barriers and exacerbate the impact of opioid use. Now,
I think we lost your feed. We lost your audio feed. Oh, okay. I'm sorry. Dr. Moto, can you hear me? If you hear me, we lost your audio feed. So I'm going to... Oh, okay. Sorry, we lost you for about 30 seconds. So if you can go back to what you were saying, please.
Sorry. I was saying that... Sorry about that.
What's that?
Some of the resources that are available within the Sub-Saharan African communities, although we have organizations like Progressive and Individual Resources, Alliance Well.
Okay. Yeah, I'll have to come back to you. But I think I would like to come to you, Madam Veronica, at this point as we try to figure out the audio challenges of Dr. Moto. Please, we want to know, how can we specifically address the mental
African
health
communities?
Oh, okay. I'll come back to you. We still have some challenge, but we will try to deal with that. But in the meantime, let me come to you.
Okay.
Madam Veronica, we want to know, how can we address the mental health and substance abuse challenges that are faced by the youth? I know your work is really tailored towards the youth. We want to know, in what ways can we really help them? Oh, sorry, you're on mute.
Sorry. So let me start. We have two types of youth that we're dealing with in America. The first is the youth that come here with their parents, who come here younger, or and they're living with their parents. That's one set of youth. We have the other set of youth that are college youth that have come here by themselves and live here by themselves, and so they don't have any parents with them. That's another different set of youth. So I think Maru Kiptuya has mentioned one. So with the ones that come with their parents, are the ones that we see more than the ones that came to college, because the ones in college don't really come out or get absorbed or just live their own lives until they get into the system, and then you get to hear about them, whether they're admitted in the hospital or they're going through challenges, and they reach out, and we support them the way we can support them. With those ones, they're easy to get because they come to us, and they usually will seek those help, or we get them as the system gets them. With the youth that come with their parents, our parents become gatekeepers. Parents, we need to let go. We need to let this youth get the services that they need. A lot of parents hide because they don't want people to know my child is going through this, and so they're hiding until they get to a place where it's critical. Then they're coming out, and they're coming out to seek help when we could have gotten this earlier and helped it out. So parents are becoming our biggest barrier. I think they put a barrier on, this is my child. If parents talk openly, if you have your child who's doing drugs, or using drugs, or in using substances, different substances, can be drugs, can be alcohol, talking about it helps parents know that they're not by themselves. Talking about it and seeking help will help that child. If you keep quiet and bury it and say, what will the neighbors say? That's our biggest problem in the African community. What will people say? We need to get out of that. My mom used to say that, you can wear a beautiful red dress, you look so beautiful, but there's always that one person that will say, why did she pick red? So in life, there's always going to be that one person that will say something. Whether you look as good as you can look, there's that person that will say, why did she choose red? So if we put that in our lives, there's always going to be that one person that will say something. So if we keep thinking about that, who is suffering? Your child. Who's suffering? Your whole family, because some of this affects the whole family. When one child is going through something, the whole family suffers. So we need to actually start addressing it. You look at the Somali community, when they started talking about opioids, a lot of parents say, my child is not doing it. I've heard it from so many parents. Oh, my child goes to church, they're the praise and worship leader. But they're not understanding that these children hide. And when you talk about to them and say, why are you hiding it? They say, oh, when I tell my mom, she'll get upset, she'll yell at me. So the mother has created or the father has created this situation where the child is not open enough to talk to them. So they're suffering inside on their own. They go to school, they maybe talk about it to the counselor in school. And then when it's brought to their parent, the parent already says, oh, no, my child is fine. Oh, my child wants to be given drugs that Americans use, and then it will spoil their brains. That mentality is no. Your child went to seek help, and they've seen a clinician, and under clinician, this is what they're getting. But a parent will say, no, my child is being given these medications. These Americans are trying, no. Parents need to be educated. And as we're talking with Dr. Ola today, we said, we gotta educate our parents. We gotta have these parents come and sit down and say, this is what's going on, This is what's out there, and this is what we need to prevent. And parents accepting it. We can talk till tomorrow. As long as parents are not accepting this, it's a dead end.
Okay, so indeed, it goes a very good point to say, like you have pointed out, that it takes a village, but of course, parents being the gateway to how these kids are brought up, indeed have to come together like we are doing to really listen. I think I brought up this question because I believe it sinks in with your submission. It says, what do we do to the youth that have been brought up in Africa with the parents' guidance and controls, But as soon as they land abroad, they get freedom away, and even in presence of their parents, and so end up involving themselves in drug abuse in the name of they are free and nobody should interfere with their space. What should we do? I mean, so I'm sure if Madam Veronica wants to take it up, either than that, I can actually call on either Dr. Ola or anyone who wants to take up this question.
I can take up a bit and then we can open up to Dr. Ola and the rest. And as Dr. Ola said, the immigration part. We get here and we get that mentality. I've had a parent saying, oh, I don't want CPS to come to my house, so I'm not going to address what is going on with my child. I'm just going to hide it. People don't realize that CPS just don't come and take kids like that. And that's one of the things I've had a parent say, oh, you want CPS to come to my house? No, that's not it. You know, we want to take care of this youth, these young people, and not think about, oh, they're going to be taken by CPS. How do we address that? Because that's one of the biggest things I've had from parents saying, oh, CPS is going to come and they'll carry the children. You know, so that freedom, that sense of freedom that they're getting, they're scared of it too.
Mm-hmm.
So I think part of what is, I said the second bit of the youth we have is those who have come here by themselves. So they have F1 students, they have the J1 waiver. Those are the ones that we are hard to get because they get here and they have that freedom in quotes. They're not gonna they don't want to tell anybody anything because I know what I want and I'm not going to tell anybody. So those kids are the kids that, you know, you can't guide them because they're living in school. We can't find them sometimes. As I said, we find them when they're already, you know, in problems. So are they in jail for DUIs? This is their third, fourth DUI. That's how you're catching them, you know? Yeah. Are we catching them because they went to school and in school somebody said, if you take this pill, you're gonna be study all night? Or how we getting there, you know? So as Hulda said, yeah, stigma in the African community is real. And so we have to figure out how do we educate our kids to handle the freedom that they're getting. Because I came here, I take a good example of myself, is I came here as a student, F1, I was 19. Nobody had said anything to me about drugs. Nobody had said anything to me about, you know, sex or anything. I just came here and I learned everything the hard way. You know, I had roommates that were from the American community and they used to smoke and vape and do weed. At that time, weed was illegal. But, you know, you're in that space with them. You start thinking that's okay. How do you cope? You don't want to look out of place. So I'm just going to do it because I don't want to look out of place. So it's a lot of education, especially to the parents. Yes. How do we work with the schools? Because one of the things I've done is I'm working with Mankato State. Once they have an international student come in, they contact me. So I'm able to know that they're here and you're able to follow up. So I think it also has to come with that collaboration with schools to know those students that are coming as F1s. So we're able to support them and not go through what they're saying about not knowing what's going on in America.
All right. Thank you. Thank you so very much. Of course, this is very, very, very great conversation. And I'm happy that we're able to bring it home to how migrating here, especially as youth, kind of change the narratives and how best we can do as parents. Of course, even from the comments by Mr. Mwangi, he says our community needs a lot of education, especially our parents. They need to accept and listen. I think he meant to say, especially we parents. They need to accept,
including you.
Comes again and says, very good panel of experts. In our African community. I know we are actually behind time, but I think Dr. Moto, I'll please, we were talking about your resources, and then so if you can, for the next 1 minute, talk about these resources.
Sorry about the mishap the other time. As I was saying, to better support Sub-Saharan African communities in Minnesota, we need actually providers, we need organizations that provide culturally competent healthcare. That's what we are lacking. And we are lacking that because not because we don't have those organizations. We have organizations like Progressive, Individual Resource Alliance, Wellness Center, GIHANS, Metro Behavioral Consultant, Restoration for All. We have all these organizations, but we don't have funds, that are channeled to this organization to help us provide culturally competent healthcare services to African immigrants. And we can only do that if we involve the state in coming up with these health initiatives to help us towards this goal. So far, apart from many other available resources, when you Googled, if you go to Minnesota Department of Health and Google opioid substance abuse resources, you'll find a lot of organizations, but do they provide culturally competent healthcare to Africans? No. And most of our people shy away, they keep off. So this conversation is aimed at, coming up with more organizations that are focused on African people, considering their culture, the stigma, and all that.
Okay. No, I'm happy you talk about resources, and of course, actually making sure that we channel the resources to these community organizations that are providing culturally sensitive services. I was trying to look at, because I think recently I saw that they've passed quite a good amount of money that is going towards mental health. So I'm sure we'll find a way that will make sure that we are able to advocate for these resources to come into our community, because there are real situations going on and we need real resources to tackle them. Of course, I'd like to come to you, Dr. Oni. We're talking about existing support systems that can be leveraged or enhanced to better support individuals at risk of suicide. So this one in particular has to do with the risk of suicide. And if you can also link this particular question that came in earlier about the biases that come from the side of health practitioners who may have some biases that affect the outcomes of pregnancy treatment. So please, the first part of your question, I know we are want of time, but we try to look at how can existing community support systems be leveraged or enhanced to better support individuals at risk of suicide.
Okay. Well, first of all, let me just address this question that this person has here about the clinician's culture, the patient culture, and the community culture. And I think it's very important because, like I said, culture dictates what you do, what you eat. The food you eat, the food you like better is culture. So everything surrounds culture. So that is why we need to also continue to make sure that these providers who are not part of us, we give them education as to what worked for us. That is one of the reasons why we have African Mental Health Summit every year that brings together over 200 people that are clinicians, not from our own community alone, so that they hear from us what works. And anybody watching this afternoon, I will implore you to attend our 10th African Mental Health Summit that is coming up July 12th. And that is where you're going to see those differences about clinician, the patient, and we will hear providers talking about this. What works? We don't rely on evidence-based. We rely more of practice-based. The people that you serve are the one that can tell you that this method works, not any journal. Journal is what you put in the journal that you read. And people who put it there are the people that it work for. It could be only Western world. We want things that will come from our own side. So that is one of the areas that I just want to address that part.
Okay.
The leverage is very important. Leveraging what we have currently is the fact that Dr. Moto said something about, we have some organizations right now that are providing services, but the type of services they provide, they may not have enough resources to build it up and leverage what we have right now to what we expect to have. And so it is important that we have what we have right now is a foundation. And that is why we want to have this meeting tomorrow to start telling people this is what we have, like Dr. Ola said, assets. Each community has an asset that we need to leverage with request. And so we have skills, but how do we make this skill available to people? Now, it goes back again to what Veronica mentioned. what will people say? I usually coin it as community gossip syndrome. That is what I see. Now, when it happens, it's no longer gossip. It becomes public information. So why do you think what you are hiding will not come out to be public information? And so when people care too much about what people will say, then it affects the service they receive. So Veronica, you mentioned that very correctly. What I just say is it's a syndrome that we need to see. Just like some of the cultural bound evidences of services, some of our evidences and some of our cultural psychiatric issues are not in the classification. And so that is why people call it cultural syndrome, that is really part of you and it's only your population. It doesn't go anywhere. And that is why people don't understand those things. So it is important that we leverage our current level of information to build upon that. We have it, we just not leveraging them. Like Henry said, we need to bring all the providers together and leverage our resources
And
so
leverage
that we become
our
powerful.
resources.
Thank you.
Wow, thank you so very much. I'm excited to know that indeed, even beginning tomorrow, the facilitated conversation on mental health, opioid awareness, and of course, suicide prevention within the Sub-Saharan African community is coming up. And I think that is one way the community organizations are leveraging their resources to do this. These are very critical conversations that we need to have. I play golf, and recently, I think about 4 or 5 days ago, a golfer actually committed suicide, and he's a pro golfer. He was actually part of the Schwab Golf Challenge that was taking place. He played Thursday, and then Friday complained that he's not feeling well. So he withdrew from the tournament. And in the ninth, he killed himself. So as a golfer, I can relate in many ways, and I've been very affected by it. So I'm just imagining people like youth who haven't had very developed brains to learn of other youth taking their lives. And I'm sure it by itself is giving them lots and lots of mental agony. So definitely these are very important conversations that we're having. I think we've got quite a number of comments that are coming in. We'll try to read through as many as we can, even though we are want of time. Okay, so Madam Lauren also comes in again, says, Miss Rotich, you raised a very good point about the F1 students as well. Having been there myself, it can be a very isolating experience. And often students realize they are in need of help when a problem has already begun. Thank you so much for sharing these thoughts. And of course, Charles Maisaibi says, this sometimes goes beyond youth and it's real even among parents too. So we're talking about the substance abuse. Of course, it's not only a matter of the youth getting into it. Of course, some parents are also being affected. So please, parents, if you know you're affected and you need help, reach out. There is so much help for everyone. Maru says, I agree with my colleague. Parents need education more on methods of approach. And also, they also need to know that they are far away from Africa. And so should know what to adapt and what not to in the foreign land for the benefit of their children. Indeed, there has to be a lot of learning and relearning. Mr. Mwagi coming again says, I think it's imperative to engage with or have a dialogue with our community pastors. I think this conversation will delve deeper. There's a couple more comments coming in, but before I even read them, I'd like to come to you, Dr. Oni. Dr. Ola, at this point, I would like to know what role can family and community leaders play in suicide prevention? I think we don't want to lose any of our people to suicide. So we want to know specifically what role can we play and how can we even ensure that these community people or all of us are playing this role?
Thank you very much. I think, we said it all. We need to do a kind of community education for people to understand the risk factors that I talked about earlier. And we also need to do a lot around changing the narrative of mental health and suicide. The reason is the way we talk about it criminalizes it. When you say people commit suicide, it has become an offense. So we want a situation where people will be empowered to use the right language and also have healthy conversations around mental health and suicide, Also, it's important to identify the risk and protective factors associated with individuals at risk. And that's why it's important to do all the trainings that we have in the community. Youth mental health first aid training is for those people working with youth. And, talking about training pastors, I know Henry, Dr. Oni, and Veronica can attest to this. A lot is being done around that, but we need more our communities to be receptive of what we are planning to do. Because sometimes when you bring good ideas, competition divides us. So when we collaborate, it's better than when we compete. We all want the community to do well. So we need to come together. And that's why we are going to talk about the need for us to really adopt a coalition approach, where all these organizations will come together, families will come together, institutions that are working with us, they will come together for the common good of our community. And I think we need a lot of culturally sensitive mental health education program. When we talk about this, we need to change our mindset and not attribute the cause of mental health to the spiritual alone. That is done in our culture. Once you see someone not aligning in all ways, we start saying, maybe the person committed a sin, maybe the person has offended someone. So we need to have a mindset, and we need to change our mindset and also understand the languages that we use around that. I'm going to say that we need to be empowered to know the languages that are appropriate when talking about this. And when we use the wrong languages, it fuels the stigma. I know someone talked about the community after having this kind of adversity in their home. It was the family members that were really, talking to the person. Why did you allow this to happen? It has happened to me before. My son was sick, had cancer, and someone was telling me, what were you doing? Were you sleeping? They ask questions like that. It makes you feel guilty. And you become defensive, in that situation to say, no, I'm doing my best. I'm doing what I need to do. We cannot continue that way. We need to hone this problem, identify the risk factors, identify the protective factors, so that we can come up with the interventions that will work with our community. And one other thing that I've noticed, we don't appreciate the assets in our community. It's a big problem. We don't need to speak good English. We have accent, good, but we have good ideas. A lot of us, we are not receptive to ideas. We push back a lot. We have that mindset, someone is coming to take my idea, someone is coming to do this. We need to have a change of mind about that. Let us know that, we work for the common good of the community. Tomorrow, we will talk a lot about the need for us to really adopt this coalition approach. And I know Dr. Oni and Eri will talk a lot about that for communities that are interested in being part of it. Thanks to Minnesota Department of Health, they are really pushing us to do that so that they can better support us. Because if we come together and we have all the assets in the community, the resources that we have, we can put it together to really do a lot around community education for our faith-based leaders, helping professionals to better understand the risk factors and the protective factors that we have in the community. Thank you.
All right. Thank you so very much. We're going to run through a couple of comments, and then I'll come to you, Mr. Henry Momayi. Of course, Huda Momayi Hitsley says, Dr. Omoto, organizations' partnerships are great and are the low-hanging fruit. But I think we, as the African community, need to tap into the power of legislature. Understand that most of those funds are located at the capital, which means that we need to be at the table as legislators to fight for those specific issues at the capital at the legislative level. When we have legislators who come from our community, we have a better chance of fighting and passing that policy. And of course, there was a response to that from Lorraine, who says, Huda, this part, our community needs to really understand the power of legislative engagement. There is so much power in organizing and pushing for solutions that include legislative options. We have also a comment from a teacher, Gudita Fufa. It says, I believe the importance of this discussion for all communities in Minnesota and beyond. We are interested in working with you guys to create awareness on our media platforms, Oromo Diaspora Media, and all the social media platforms. Thank you for your service. Indeed, Oromo Diaspora Media should also be one of the media agencies that we can engage for these conversations. And of course, Huda says, my friend, we pay taxes, we need needs, but we have needs, but we are the last to fight for the allocation of those taxes. That is why I decided to run. I've been to the capital where billions have been allocated to those at the table. That opened my eyes to how much we as a collective are missing out. Indeed. Thank you so very much. That was a response to Lorraine earlier on. Mr. Momwanyi, we know we are wrapping up. So for your last question and also to wrap up, and then we will also come to each panelist to give their closing remarks. So please, Mr. Momwanyi, your question now is how can community leaders, helping professionals and healthcare providers collaborate? We talk about they coming together. We want to know specifically how we can collaborate to improve mental health and the opioid awareness among Sub-Saharan African populations. So now we want to know how these collaborations can happen. Of course, there are many means that we have already talked about, but if there's anything remaining, please touch on that and also give your concluding remarks.
Thank you. Thank you so much, Mr. Beyond. Yeah, community leaders are the entry points in each community. If we come together, representatives from each community, and have a correlation or a coalition, then we start talking about what is the best approach. And then we involve our subject matter experts and other important people like professionals in various areas. That's how we are going to face the elephant in the house. Because, I have not heard somebody talking about the stereotype in our community, which comes together with the stigma. Most of our parents, there is a very poor communication, even with their children. Sometimes, again, these parents, they don't want to open up that they are having their child or their children, are going through some, illness, mental illness, or, alcohol and alcohol use and other, substance abuse disorders because of stereotype in our community. We like gossiping a lot, as most of you have said. So the best approach is we come together as parents, law enforcement, providers, like I said earlier, subject matter experts. And then we have some town hall meetings, and let us encourage one another. Let us encourage the parents to start talking about it. You see, and I hope tomorrow you will see, after some people have done their presentations and maybe, testimonies, more parents will come out and start speaking about it. Some of us, we get some, calls from various parents are saying, hey, this is what I'm going through. Can I get help? Like you said, some of you have said, we don't have resources. We do some referrals, but most of the parents, again, they fear, going to where you're referring them to. You see, there is also a language problem. At the same time, they don't want to use somebody maybe to know what's going on in their house or in their homes. So what we need to do is, like I said, parents is the entry point, organizational leaders, entry point, church leaders, especially in our communities, the people from the south of Sahara. Most of them, they are faith-based. Church ministers have got a very big role to play in our community. We need to bring them also to take them to train on this mental health first aid, also to be in the same page to know how they can use, how they can communicate to their children, to their families, so that you can bring this thing to an end.
Okay.
And like you say, I want to close by saying, Mr. Beyond, thank you so much for this opportunity. And my fellow panelists, I hope our parents, where you are listening, please, tomorrow is your day. Ours is to, bring the resources together. I've heard of some of you say that, you need the legislation. Yeah. people from the government will be there. City council members will be there. Those people who make decisions. People like my sister Hulda said, you know, we need registration. I know you are learning for the office. Just come there tomorrow, talk about it. You need the support. We want to support you so that you can go in there and you know, bring this thing on the table. Like again, I say once again, thank you so much for this opportunity. Let us work together wherever you are. Come tomorrow, and we expect that, you know, your contributions are necessary in the community. Thank you.
All right. Thank you so very much, Mr. Momanyi, indeed, for your closing remarks. Madam Veronica, please, if you can also give us your closing remarks.
Thank you so much, Collins and the team. This has been a good conversation. It's a conversation that needs to continue and go on. I would like to tell parents, you know, if you see there are events being put out for the youth, please, please, please sign up your kids. It's hard to put up events and not have anybody coming to those events, because then we lose those fundings for those events. It is an event that's been put out to help your children. I've had kids tell me the only way they can attend events is they're done in churches. It's hard to get all events done to be done in churches. You know, we have community centers, we have all that. Parents, let's not look at the venue. Let's look at what is being given out for your children. What support is there? Because when you have a youth event, it means we've brought in all the experts that can work with the youth. We have all the organizations that work with the youth to give those resources. So what I say is, when we have those events, let's support them. Let's also support any F1 students that you know out there. If you know a student that's going to school that has come here and doesn't have parents, let's adopt them. Let's give them a home. Let's give them love. I hope we'll see you all tomorrow at the event. We'll have more time, we'll have more conversations, and we'll have more resources. And yes, let's all support Hulda get in there so that we can get those allocations without fighting for money. She can support us in this work. And that's all work. If you're an organization over there working with the youth, or please reach out to me. I'd like to get together. The more we are, in Swahili, we have a saying that one finger cannot kill lice. We need all the fingers to kill the lice. So let's all come together so that we can work as a team. If you're a parent and want to volunteer, come on. Let's come in and work together. Thank you.
All right. Thank you so very much. Dr. Oni, please, your closing remarks.
Yeah, thank you very much, Collins, for responding to our requests all the time. And we need this type of microphone to mechanize all our resources as well as our speeches tonight and information. What I want to conclude with here is to say mental health is real. Mental illness is real. Stigma is real. Stigma comes in three formats: self-stigmatization, public stigma, as well as what we call systemic stigma. So all those things are real, but they should not stop us from receiving services. It is important that we know that mental health is manageable and we can cope with it, and we have it. All of us have mental health, but people with mental illness, they did not call for it. We shouldn't discriminate it. Mental illness does not discriminate. So why should we discriminate? Whether you are rich, whether you are young, whether you are poor, mental illness can attack. And so we should not attack the attackers. Thank you very much.
Wow, indeed. Thank you so very much for that. To know that indeed we have to be compassionate towards everyone, because it can be me, it can be you, it can be anyone. Dr. Moto, please, your concluding remarks.
Yeah, thank you very much. Just to reiterate what Hulda Momanyi said, you know, in terms of being at the table where decisions are being made, that reminds me of an African saying that goes by, when cows are out there mowing, yours must be there. So as we plan on sending Hulda there, you know, numbers in America are very important. We need enhanced data collection, very specific data collection that is analyzing opioid and mental illness within Sub-Saharan African community, so that we can tailor interventions more effectively, so that we can present this information, these numbers, to the legislators and demand for our cut. Otherwise, when you look around, there's no published data specific to Sub-Saharan Africa. We can do this. We can publish this. We can do a research and publish this information and have this data and give to Huda when she goes there. She presents those numbers. Numbers don't lie. Currently, when you look at what natives are getting or African American are getting, they're getting a lot of money because they have numbers in terms of research. They have numbers showing how they're dying from substance abuse, alcohol, and all that. We don't have such for our communities. So let's do some research, come up with numbers, and present to legislators and demand for our rights.
Indeed, numbers are very important. And thanks to people like Ahuda and also Winfred, who have actually taken up on themselves to do this for our community. They need all our support, especially going into this election. And we need the resources at the stages, at the levels that they can push for legislative and, of course, policy changes. There's a few comments that have come in. Yes, I'm going to share details of tomorrow's event. Indeed, we've been talking about it. Huda also has put up her website. And, of course, I believe there's a form that Dr. Ola is going to talk about it with regards to maybe feedback from today's conversation and also how to be part of tomorrow's big forum that is taking place tomorrow. In the meantime, Charles Maisiba says, dear brothers and sisters, it is high time we know, accept, and settle down that this is home and make home a better place. Most of us are here 50-50 in African change now. Indeed, we need to make here our home. It's actually our home. So we need to really make sure that things are working and we are taking care of each other. Thank you so much for this conversation. This was so timely and encouraging. I look forward to tomorrow's conversation. Thank you so very much, Lauren, for this part of the conversation. I would like to come to you, Dr. Ola, about this, your concluding remarks. I know that your organization is, as well as the other organizations, are very much involved in what is taking place tomorrow. So please, we want to hear your concluding remarks and how people can be part of the facilitated conversation tomorrow.
Thank you very much, Mr. Beyond. And to the other panelists, I want to say a big thank you, for being part of this. And you have made very intelligent comments. You've talked about very salient points. And I want to reiterate and say that attending tomorrow's event is very important. This is the pre-event to let you know what you are coming to do tomorrow. We need a lot of our community leaders, including religious leaders, officials, respected elders, gatekeepers in the community. We need them there tomorrow. Prior to that, I put this in this chat. Please register your organization. When we say that we're doing community asset mapping, is to know the resources that we have in the community. If we don't know about it, how do we refer to culturally appropriate services? And we know that we have a lot of professionals that are qualified to really do this work with us. So please fill that form. And the second link that I had there is our Eventbrite link. Please go and register and be part of this program tomorrow. I really want to say a big thank you to all the people joining us on LinkedIn, YouTube, Facebook. Please share this link with people so that they can watch it and then come tomorrow and be part of this great event. Thank you so very much.
Indeed. Thank you so very much as well for being part of this conversation, to all the leaders who actually availed themselves for this conversation as far as the upcoming community mental health, opioid awareness, and of course suicide prevention within the Sub-Saharan community is concerned. Thank you. We have been talking largely about what it is in our community that has to do with mental health, the use of opioid, and of course suicide awareness or prevention. So we a big thank you to all of you panelists for being here. Of course, for everyone who joined us in several parts of this conversation, for everyone who was able to contribute by text messages, by comments, we say a very big thank you. It's been a great pleasure to talk to all of you. Of course, for tomorrow's event, for those of you who may, is the venue going to be at Brooklyn Park City Hall?
Yes.
Oh, okay, perfect. So the address is 5200 85th Avenue North, and it's in Brooklyn Park, Minnesota, 55443. Of course, we're talking about mental health, the opioid awareness and suicide prevention which are very critical areas of focus within the Sub-Saharan African community. So, of course, come learn all about how mental health, the use of opioid, and of course suicide are impacting our communities. I mean, these situations are very real, and hiding behind and trying to pretend that nothing is going on is actually a big problem in its own. I mean, coming together like this to talk about it, to find solutions, for me, is very important. And the good thing is that we have culturally sensitive approaches that can consider unique cultural, socio-economic factors for these issues. So please be part of tomorrow. All roads are leading to the Brooklyn Park City Hall. And of course, just be in attendance, you're going to receive a gift card of $25 for your time and participation. And of course, $25, of course, you may not be able to pay for your entire time, but then it can also go a way to say thank you to you. So to everybody who participated, I say very big thank you. It says all stakeholders tomorrow meetings, come and share, participate. Yes, so we need all stakeholders to come in and be part of the conversation tomorrow. If you need to reach Dr. Ola or Dr. Oni, you can call them on 612-749-3309. And of course, you can always reach out to Mr. Henry Momai, like all the panelists on today's program. Thank you, everyone, for being part of this. And of course, I would like to also close by one of the things that was said a few days ago when this person committed suicide is that we all have a challenge to do. And somebody said, this challenge would be to say that we have to say some great things to people that we love. There may be people around us that we love, but we have to begin to say great things to them. Say something nice to people that you do not even know. And of course, this will help us and everyone around us to actually have a good feel of themselves, because you may not know what they are going through. Thank you very much, everyone, for being a part of this program. Have a good evening.
Thank you.
Bye-bye.
Thank you. Bye-bye.
Bye-bye. Of course, it's been a great conversation right here on Africa Let's Talk. And of course, a big thank you to everyone who joined the conversation. So please keep sharing this video, but most importantly, be part of the conversation tomorrow that is taking place at the Brooklyn Park City Hall by these amazing organizations who have been a part of the conversation today. These organizations include Restoration for All, as well as Gangs Incorporated, and of course, the Progressive Individual Resources, as well as the Minnesotan African Youth Initiatives, and also the Metro Behavioral Consultant. My name is Collins Kofi Opon. Thanks to everybody who was part of this. May you have a great night. Until we come here again another time with another exciting edition of Africa Let's Talk. Have a good evening.